Just a reminder quickly, we are in the election period here in the province of Saskatchewan. Of course, the Chief Medical Health Officer will continue to hold scheduled media availabilities each Thursday during this month, with additional availabilities as required by events. In accordance with the guidance of the election period, the Chief Medical Health Officer and the Ministry of Health can provide technical and factual information, but we are unable to participate in the debate of programs, policy, or rationale at this time. So with that, we'll have a brief statement from Dr. Shahab before taking questions for both Dr. Shahab and Scott Livingstone. Dr. Shahab?
Thanks, Karen. So I'll just go over a few data points that are on our website and then make a few comments. So as we know in the news release, there are 40 new cases in Saskatchewan, bringing our total to 1927, and our active cases are at 144. And I actually go to the website every day to look at where things are at. And as you can see, our active cases are throughout the province, but notably in Saskatoon, Regina, and Central East Yorkton area. When we compare our cases to other parts of Canada, we can see that if you look at the count of active cases, we are trending upward, but comparatively, after adjusting for population, we are not seeing the same surge that other parts of Canada and other parts of the world are seeing, especially if you look at the rate of active cases, as you can see here. But so certainly our active cases are trending up, but are not at the moment showing a surge. And when we look at other sections of the dashboard, if you look at new cases, as on this slide, you can see that our new cases went down, really down in May, June, and then again August, they were really down, but now they're trending around 5 to 15 per day, and sometimes they reach 20. So our new cases are trending up, and we were expecting to see this, especially as schools open, as our economy reopens. But we need to make sure that we do everything that we have been doing to keep this curve as flat as possible. It may not be as flat as it was towards the end of summer, but even now we need to keep it at this level that we are at currently as much as possible. And we know how to do that. We have to, for the most part, stick to our virtual household. Consider especially those who work in high-risk occupations or work with vulnerable people. These individuals especially need to be very careful when socializing outside of the virtual household. And we also need to look at very carefully any gatherings that we are having outside our immediate household. They should, for the most part, be limited to our virtual households, and if we have any gathering up to the allowed limit of 30, we need to make sure if people are coming who are not part of our virtual households, that we have enough space and we organize those gatherings safely. Secondly, and when we look at our active cases by region, as you can see, they are throughout the province, but notably over the last 4 weeks in Saskatoon, Regina, and the Yorkton area. If you look at our testing numbers, they are very good, and they continue to be high. And this is another reminder that if you have symptoms, if you have any concerns or have been directed by public health, do promptly get your test, because by getting tested, you inform yourself about isolation, and your close contacts can be isolated. And through that testing and case contact investigation, that is the most effective strategy, in addition to all the steps we're taking individually to break the chains of transmission. And that is happening very successfully as we speak in Saskatoon, in Yorkton, where we've had specific transmission events. And finally, our hospitalization numbers, again, they have a lag of 1 or 2 weeks from our active case numbers. But again, they were extremely low throughout the latter part of the summer. They have been trending up. There's a bit of a downward trend. But again, similar to our active case numbers, these are the kinds of things that we need to keep a close eye on. Another thing that we expected to see was that we would see the occasional case in a school, which we've seen. We have up to about 14 cases who have, for the most part, had 1 case each. In Yorkton, there was a school with 4 cases, but there was no evidence of transmission in the school. For 2 schools, actually, the issue has now been resolved. So most schools see a case, public health does an investigation. After 2 weeks, everyone's back at school, no further issues. But it is important that we all continue to do what we're doing, children who are going to school, teachers and staff in school, people who are going out to work, maintaining that physical distance, using all the other layers of protection, hand washing, wearing a mask where required, not going to school or work if you're unwell. And we have to remember that given what's happening through other parts of Canada, rest of the world, this is a strategy that we have to keep doing for the rest of the fall and the winter. These are behaviors that have served us well, and it's important that we continue doing what we've been doing to make sure that we stay at the level we are at. And this is up to each of us as individuals and households. And these decisions protect us, they protect people who are more vulnerable, and they protect the community at large. And finally, I'd just like to say thank you to all the teachers and students and staff in schools. It's been now, and we are in our fourth week of school reopening. There has been nothing unexpected, and from what I've heard, things are working quite well. But it's important that we stay the course. We'll expect to see the occasional case or two in a school, but as long as we can keep our overall numbers low, as long as we can keep our community transmission low and react promptly when there's a case or cluster, we can stay the course at which we are at currently. Thank you.
Thank you, Dr. Shahab. We'll move to questions now. We'll start in the room. Stephanie?
Yeah. Doctor, can you provide an overview of how many cases are tied to that Yorkton outbreak in particular and where we're at on that?
So the numbers I have currently are 14, but we will continue to update. And again, it's primarily one linked outbreak investigation linked to a private business, a gym, and then cases that were going to one school, but the transmission likely happened outside the school, and 3 cases linked to Yorkton Regional Health Center. Again, transmission happened outside the health center. But of course, whenever there's an active public health investigation, it generates contacts, which in this case are more than 100 contacts, and through follow-up testing, we expect to see more cases as part of the active case finding that's occurring.
At this point, in being cognizant of the fact that we're into the fall and we're kind of going to be into the winter soon, should asymptomatic people be going to get tested, or should the priority be if you're symptomatic?
Yeah, so right now we have sufficient testing capacity, and of course, if anyone has symptoms, testing is really important to inform you and your close contacts. Secondly, there are situations where there's targeted asymptomatic testing. So whenever there's an outbreak, for example, everyone who may have gone to a certain business or may work in a certain setting like a workplace may be requested to get tested by public health. They still have to isolate, but if required, if they are tested even if asymptomatic, that may uncover further cases so that they are isolated, and then their close contacts, including their household contacts, are isolated. So it's quite an intense effort when there's a cluster or an outbreak to break the chain of transmission. Beyond that, at the moment we do support asymptomatic testing, and the purpose of that is really that if you have traveled to another province, for example, or if you have any concern because you went to an area where there was a PSA, generally if you haven't been told by public health to stay home for 14 days as a close contact, you still have to self-monitor for 2 weeks. For example, if you went to a place where there was an infectious case announced. But if you have any concerns, it's always a good idea you get tested. Currently, we have the capacity to support that, and that testing informs us that what is the community transmission rate throughout Saskatchewan.
Thank you, Doctor. We'll switch to the phone now quickly. Do we have a caller on the line?
We have Mark Smith from CTV.
Hi. With 2 schools now impacted with COVID cases in Yorkton, is the province considering putting more guidelines in place for teachers, parents, students? Would that be something you would consider?
Yeah, so at a local level, medical health officers and public health is in regular communication with schools and school divisions, and at my level, I'm in regular communication with education and school divisions as well. And it is really important that at the moment schools, and we keep checking in on that, schools are operating at the appropriate level based on the level of community transmission where they are at, and if there has been a case or a cluster in their school or in surrounding schools. So this will continue to go up and down. As you know, most schools are operating at level 2. A few schools initially started operating at level 3. They have come down to level 2 because they are parts of the province where there's very low community transmission. And so this is serving us well in terms of this constant communication between public health and schools. And this will need to be constantly adjusted. Schools, there will be instances where a student stays home, like for the vast majority of schools, and a few close contacts stay home. There may be situations where the whole class goes online, and really there may be situations where the whole school goes online for a period of 2 weeks. And this will continue to happen, and we'll obviously continue to monitor and update guidance as required.
Mark, do you have a follow-up?
Yes, drive-through testing in Saskatoon and Regina has been in pretty high demand. How much would you attribute the rise in cases in those two cities to drive-through testing being available?
So I would maybe make an initial comment and ask Scott to provide further detail. But generally, testing is widely available throughout the province, and based on the access, we want to support testing throughout the province. But obviously, Regina and Saskatoon are two large urban centers, and so maybe I'll ask Scott to see what proportion is now being done at drive-through and whether that has increased overall testing.
Thanks. So I don't know off the top of my head the proportion that's being done at drive-through, but it is the vast majority. I would just say that, and Dr. Shahab could follow up on this, but with respect to the finding cases, specifically to the drive-through centers, if we're having referrals from 811 or asymptomatics come in and they would be positive, I'm not aware of any major number over and above what our usual testing rates are, because most of the outbreaks that are going on in the province in Saskatoon and Regina are related to known gatherings, but Dr. Shahab could certainly comment on that. But we continue to expand the drive-through testing and make asymptomatic testing available, but we also are testing through symptomatic patients as well. But we do recommend that symptomatic patients phone 811 and get a referral, because they need to immediately self-isolate, as well as we need to start that contact tracing immediately.
Yeah, thanks, Scott. One comment I'll make is that our overall test positive rate remains below 1, which is very good. We also, under the Safe Schools website, list testing rates and test positivity in children, school-age children. That's around 0.3 to 0.5. So again, everything we're looking at shows that there's sufficient testing happening throughout the province, and the test positivity rate overall remains low, which is very good.
Thank you.
Laura from CBC. Hello. I'm wondering what you make of some citizens and businesses and the chamber in Yorkton downplaying masks and the issues they're experiencing.
Yeah, I think what I would like to say is that obviously, it is difficult for everyone to practice all the steps that are so important. We have to maintain physical distancing when we go out and about or go to our workplaces. When we're indoor with people who are not part of our cohort and where we can't reliably maintain a 2-meter distance, mask use is an important additional layer. And these things are every thing that all of us do keeps our overall numbers laid. So while it is an additional, kind of responsibility for people who are going to work or shopping or even children going to school, it does provide an extra layer of protection. So I would strongly urge, especially as we enter the fall, that we practice all these layers of protection. Staying home if you're sick, when you're out and about, especially when you're indoors where you can't maintain 2-meter distance reliably, wear a mask, hand washing, and all of these will have incremental impacts on keeping our numbers low. And we've seen that this is a time when we have to do all this diligently, because we are seeing cases going up significantly in many other parts of Canada and the world.
Follow up, Laura?
Yeah, were there any specific government instructions related to the construction industry, I'm wondering, about COVID safety precautions?
So I may not be answer this question specifically, but all workplaces have guidelines and where you are to practice the same things we need to practice when going to school. It doesn't matter if you're going to a retail environment as a customer, if you're going to a workplace, if you're going to a school, the principles are the same, but then each industry or workplace needs to look at their configuration and provide more specific details under their Occupational Health and Safety Act. But the specific guidelines speak in more detail to places which are open to the public, like restaurants, for example, that are very specific guidelines that have worked very well. But otherwise, all workplaces should also look at the layout, and this is a good opportunity actually, given that we've had a few clusters in workplaces, for everyone to look at, how staff come, how can they maintain hand washing, hand hygiene, physical distancing, mask use where required. Obviously, if you're in your cubicle or office on your own, you don't need a mask, but you should when you're in a common area or in a meeting room where you can't maintain that physical distance. All these things are important, and every workplace should be conscious of that.
All right. Yeah, sorry. Well, we'll jump to the line. We've got a few others waiting. The next caller, please.
We have Britton Gray from CJME.
Yeah, hello, Dr. Shahab. I'm just wondering, we're reading through the release put out today with the numbers, and it says that if a person's symptomatic, they're supposed to wait, they'll get tested 48 hours after they call 811. Even to go to a drive-through, people are symptomatic or has to wait 48 hours. Why is it 48 hours now? What has changed that you can't just go once you start feeling maybe a sore throat?
Yeah, I think everything is a balance. Generally, testing is available to everyone, but if you have just a slight sniffle, you should obviously isolate at home. The test positivity is better if you wait 48 hours. But again, I think generally testing is widely available, but 811 will, first of all, we do our own self-assessment, and then if you call 811, they'll further assess and advise, and all those layers are there to make sure that if you are COVID positive, the test will pick that up. Beyond that, Scott, I don't know if you had anything further to add on that.
Only that nothing has changed. That's been the way the 811 has been managing callers with symptoms since day one, and it's related to the accuracy of the test and the onset of symptoms. So if somebody's had symptoms for a number of days, it's my understanding, and Dr. Shahab can correct me if I'm wrong, but that they're not told to wait 48 hours, but if somebody phoned the day of a symptom, they would book them in 48 hours later so that the likelihood of the test, the test's more accurate when you have symptoms for a couple of days.
Thank you. Britton, do you have a follow-up?
Yeah, just kind of with the election and everything underway, people are going to start maybe getting out a little bit more, especially with the weather starting to get a little cooler. People want to get one last thing out there. So what's kind of the advice for people want to get one last kind of weekend out there if they can?
So again, outdoor activities are better than indoors, and we've seen that throughout the summer. But obviously, while we don't expect to see the same level of outdoor activities over winter, staying healthy and being out and about, and especially where you can, enjoying the outdoors is important. Having said that, as we go look at the fall and have more indoor activities, all those layers of protection, physical distancing, hand hygiene, staying home if you're unwell, and mask use where appropriate are going to be essential. And finally, I would say that October is a busy month with flu vaccination starting, a lot of other activities. So again, all those principles are going to be more important because we have children now going to school. Most workplaces are open. So all those things are important, both when we are socializing with our extended family bubble, when we're out shopping, when we're at work or school.
Thank you, Doctor. Moderator, do we have another caller on the line?
We have Tia James from the Star Phoenix.
Good afternoon, Dr. Shahab. I have a question related specifically to the limitations on visitors at the Yorkton Health Center. I just wanted to ask if there was anything specific that you were seeing that led to that particular decision to put limits on visitors.
So maybe I'll ask Scott to speak to that.
Sure. So when there are healthcare workers that are COVID positive, regardless of whether they get it in the facility or from outside the facility, as a precaution, we would reduce visitation until we are done contact tracing and we know that there is not a bigger problem within the facility. And also, as you know, we would be dealing with close contacts of individuals that would be positive.
Thank you. Tia, follow-up?
No, not at this time. Thank you.
All right, we have another caller. Moderator?
We have Connor O'Donovan from Global.
Hey, I'm just wondering if I see that there's data for the 21st to 27th with regards to youth infections. I'm just wondering if we can get a more up-to-date rundown or breakdown of cases detected by children or staff, I guess, attending schools.
Yeah, I think we will try to see how up-to-date we can be, but there is a bit of a lag in kind of analyzing that and then posting that, but we will try to see how up-to-date we can be. But certainly all the data on a dashboard is as up-to-date as is reasonable. So some things are updated same day, some do require a few days for analysis.
Connor, a follow-up?
Yeah, and I guess, Dr. Shahab, you said that, seeing a case or two in schools is to be expected. Is that kind of how you foresee this going for the rest of the school year, or are there times when you think there might be a particularly higher risk, like say in colder months, where you might see more than a case or two or more than an outbreak or two?
So we've been looking at case numbers in schools throughout Canada as well as Saskatchewan, as well as the experience in other parts of the world. And so the first thing we need to recognize is that schools in general reflect the community. So if community transmission rates remain extremely low, we expect to see very few cases in schools. But if community transmission rates go up, then we expect to see more cases in schools, and that's what we've seen in Saskatchewan for the most part, and other parts in Canada. But having said that, even then, it's really important that everything we do in the community to keep transmission rates low is important, and everything that schools have demonstrated that they're doing, so that if there is a case who may have gone to school before they develop symptoms and a public health investigation is done with the school, we have seen that for the most part we are not seeing outbreaks in schools, and that's really important as well. That it's really important that everything that we are doing continue to, so that even if there's a case who may have gone to school before they were symptomatic, we are able to prevent large clusters or outbreaks in the school setting.
Thanks. Dr. Stephanie?
Yeah. Doctor, what has been the uptick for the COVID-19 alert app, the one the federal government introduced and we signed on not too long ago?
So we can try to see if we can get information on how many downloads there have been. But certainly that's a good point that I think I would encourage everyone to download the COVID app. I have it on my phone. Remember to switch your Bluetooth on when you leave the house, because if your Bluetooth is off, it doesn't work. And actually some people said that it drains the battery. I did leave it on with the Bluetooth on for 24 hours. In my case, it didn't seem to drain the battery, so it's easy to download. And I think this is going to be an important addition to contact tracing. It doesn't replace contact tracing. That detailed interview that public health does with a case and contacts is essential to break chains of transmission. But this is going to be essential in settings where you don't know who your close contacts are. So in a workplace or in school, you do know. But if you're out and about shopping, going to see a movie, going to a restaurant, having this app download and active is important in my view. I would say very important, and it's only useful if everyone or most people have it downloaded and active, because that's how the data is then useful. Because then if you were to become a case, you would get a code by public health you would put in, and that everyone in the last 15 days who had the app downloaded, Bluetooth active, and had been within 2 meters of you for 15 minutes would get an alert notification, and then they could, that would be a guide for them to self-monitor. They could, if they had symptoms, it would be prompt for them to get tested, isolate at home, and seek advice from public health.
Any follow-up, Stephanie?
Yeah, we've seen the number of cases rising in Ontario, Quebec, BC, Alberta. Is a second wave inevitable in Saskatchewan? I know we were late compared to other provinces when this virus first arrived. We got it late March, some had it February, the month earlier. So is a second wave inevitable in Saskatchewan?
So if you look at provinces in Canada, the curves are different. There's various aspects, population size, other aspects. If you look at Europe, different countries are having a different experience, and that's why I would say that it's really up to us to a large extent. The risks of transmission, we've always said, will increase in the fall as we move indoors, but then it's doubly important for all of us to practice what we have been doing so well. And again, so to a large extent, the outcomes depend on all of us, and it does mean all of us, not just a few of us. It means all of us.
Thanks. We'll take our last few questions. Laura?
Yeah, so we received confirmation that a staff member at the Saskatchewan Penitentiary has tested positive for COVID-19, and I'm wondering if you can kind of speak to what you know about that incident and so on.
So as of the information I have, there has been one person in a penitentiary in Prince Albert who has tested positive, and as per routine procedure, public health is working closely with corrections to obviously the person who may have been at work before they became symptomatic. There's an assessment done that, okay, who else is a close contact? So those close contacts would be put under isolation. Any other people who require self-monitoring would be put under self-monitoring. Further testing would be done. So this is a routine procedure, whether it's corrections, school, any other institutional setting or workplace. And so those measures are being taken right now. But at the moment, it's one case, but there's active investigation happening as we would do in any institutional setting.
Follow-up, Laura?
No, that's okay. Thank you.
All right. With that, thank you, Dr. Shahab, and thank you, Mr. Livingstone. That concludes our update for today. We will send a media advisory if there's additional opportunities, but otherwise next Thursday at 2:30 will be our next COVID update. Thank you, everyone.
Thank you.